turning a group practice into an IOP or PHP in Vermont breaks down at one overlooked gap. Certification readiness and payer readiness are not the same, and asking only about certification misreads the entire conversion. Becoming a structured outpatient program is not just a new clinical schedule. It touches certification, Medicaid enrollment, payers, staffing, documentation, and your site. This is a readiness guide for Vermont group practice owners deciding whether an IOP or PHP expansion is realistic, and what to verify before launch. So, what changes when an ordinary outpatient practice becomes a structured treatment program? In Vermont, you need to understand the Department of Health Substance Use Program's treatment provider certification language, plus Medicaid provider enrollment, payer readiness, documentation, and staffing, and whether your current site can support structured outpatient treatment at all. Here is the cost of getting this wrong. A Vermont practice can misunderstand the whole conversion if it asks only whether certification is required. Relying on Medicaid or commercial reimbursement before verifying enrollment, credentialing, authorization, and documentation expectations puts the entire revenue model in question. And if the site cannot support the model, certification and payer assumptions harden into commitments you cannot deliver. This is the work Behave Consulting helps operators pressure test before launch. That means source path review, payer readiness, documentation workflows, admissions design, and implementation planning. Then Behave Help's EHR, CRM, and RCM are designed to support the program once the structure is ready. Readiness comes down to 5 areas. Work through all 5 before you market the program. Here is each one. Area 1, certification. Resolve which agency has authority and what service definition applies to the program you intend to run. Start with the Department of Health Substance Use Program's Treatment Provider Certification page and Vermont's Substance Use Disorder Treatment Certification Rule. Then ask whether the group practice model still fits, or whether the population, service intensity, and staffing call for a different operating structure. Area 2, Medicaid and commercial payers. If Medicaid revenue is part of the model, review Vermont Medicaid provider enrollment before depending on reimbursement. Verify program credentialing, medical necessity criteria, documentation expectations, authorization review, and level of care billing with each payer. Treat payer research as questions to verify, never as reimbursement assumptions. Area 3, staffing and clinical leadership. Define the level of care, how admission and clinical screening work, and how group and individual services fit together. Decide who provides clinical leadership, and how treatment planning, discharge planning, and utilization review get documented and handled. Do not build the staffing model from a generic public matrix. Start from your population, certification implications, and payer expectations. Area 4, the site. Can the office support confidential group programming with longer and more frequent sessions without disrupting privacy and flow? Does the layout work for screening, admissions, family participation, safety procedures, and discharge planning? Check lease terms, accessibility, and local approvals against the program you intend to verify. If the site fails, revise the design first. Area 5, technology. Test whether your EHR, CRM, and RCM can support admissions, group schedules, and treatment plan reviews. Plus, authorizations, staff credential tracking, utilization review, Medicaid and commercial claims, and reporting. Before launch, verify the current Vermont path with every stakeholder. The Department of Health Substance Use Programs and its DSU certification materials. Vermont Medicaid and your target commercial payers. Qualified counsel, the relevant agencies, and your implementation team. Stop building your Vermont IOP or PHP on unverified certification and payer assumptions. See how Behave Consulting pressure tests the conversion. Book a 20-minute demo at behavehealth.com. Behave Health's EHR, CRM, and RCM are designed to support the program you launch. Book a demo at behavehealth.com.